Hi everyone, welcome back to Mohivate. I'm Dr. Mohi Sarawgee, a GP by profession, curious like all of you, and constantly on a journey of hope. But here, I'm swapping prescriptions for perspective. As the northern hemisphere tilts towards winter, GP practices, hospitals, and emergency services gear up for the season's familiar pressures. The surge in sickness and waiting times, the longer shifts, the shorter daylight, and the quiet fatigue that follows. Though this episode lives in winter, its heartbeat is timeless because exhaustion doesn't follow calendars and compassion doesn't come with annual leave. This episode is a note of gratitude to everyone who keeps our health systems breathing: the nurses, therapists, pharmacists, paramedics, receptionists, administrators, and countless others who show up even when their own hearts feel heavy. You steady your voice when your hands are trembling. You hold space for others while quietly, maybe holding your own pain. You're all part of the same heartbeat. But today, I want to turn the stethoscope inward to the doctors, because even those who take responsibility for mending others sometimes need a moment to mend themselves. So, from one doctor to another, this one's for you. And if you are listening as a patient, this one's for your doctor too, for the person who holds your story with care, even while they may be writing their own between the lines. Today's episode is a little different. It's not about a hormone, a molecule, or a medical mystery. It's about something doctors rarely talk about. What happens when the person who takes responsibility for others' healing begins to run out of care for themselves? We take an oath to serve, to stay steady in the storm. But no oath makes you invincible. Because somewhere between the prescription pads, the surgical gloves, the calm faces, and the brave words, we forget that doctors aren't made of immunity. We are made of empathy. And sometimes that empathy fractures under the weight of everything we are supposed to carry. Medicine trains you to stay composed, to separate logic from emotion. You're taught to say, I understand, without trembling, to hold bad news gently, to close one door while another opens with the next patient already waiting. You master that calm clinical nod, even when your brain is quietly pleading for just 5 hours of sleep. But the body keeps score for everyone, even for doctors. Studies show that doctors experience higher rates of anxiety, insomnia, and burnout than the general population, and yet are far less likely to seek help, not because they don't believe in care, but because they've become too used to being the caregiver. The white coat in some ways becomes armor, but the trouble with armor is it protects you and it isolates you at the same time. Empathy is, after all, a biological process. Mirror neurons in the brain allow us to feel what others feel. They are what make us human, but also what exhaust us. Over time, constant exposure to suffering triggers cortisol surges and dampens dopamine reward pathways. You stop feeling joy in small wins. You start feeling tired even after rest. Psychologists call this compassion fatigue, but really, it's chronic emotional overstimulation, the nervous system's version of an overworked muscle. Healing from that isn't weakness, it's neuroscience, recovery of your own reward circuitry. The brain can rewire itself. That's neuroplasticity. And neuroplasticity doesn't just heal trauma, it rewires resilience. Every act of self compassion teaches your brain safety again. That's how healing begins, one kind signal at a time, directed toward you too. Doctors are trained to hold the line, to absorb fear, grief, anger, even blame. You carry the unspoken expectation to be the calm in everyone else's storm. But storms have sound. And after years of listening, the silence in your own head can become deafening. Studies published in the Lancet Psychiatry found that doctors often suppress their emotions until they manifest physically. Headaches, insomnia, muscle tension, weight gain, skin flare ups, or GI issues. The body whispers what the mouth refuses to say. Sometimes it's not even trauma that breaks you. It's the quiet accumulation of small moments, the missed lunches, the unshed tears, the emotional self editing. And still you show up. You show up with your stethoscope, your science, your expertise, your smile. And that's not just professionalism, that's courage in disguise. Sometimes the hardest part isn't the long shifts or the endless notes, it's the silence, the way you walk home after a difficult case and no one knows what you just held together. The world claps for the cure, but not for the cost. And yet, somehow, you still show up. For the time your Christmas or Thanksgiving leave wasn't approved, for the family event you couldn't attend, for the patient you stayed late for, and the one you lost sleep over, for the time you cared for everyone else while quietly postponing your own life. And still you show up. That's not habit, that's heart. And no, nobody asked you to. You did it anyway because duty became instinct and caring became a reflex you never learned to turn off. And sometimes that instinct, that reflex follows you home, into your relationships, your routines, even the way you silence your own needs. But that's also what makes you who you are, someone who still believes that care matters, even when it costs you. And sometimes that quiet persistence is what keeps the system and your patients afloat. Doctors speak fluently in reassurance, but not in rest. We tell patients to hydrate, to breathe, to take time off, then grab a bite over a keyboard and call it recovery. We turn our own exhaustion into efficiency, and in the long run, you realize you are basically running on caffeine, adrenaline, cortisol, and misplaced optimism, a medical miracle in itself. The nervous system learns patterns by repetition, not intention. So, if all it learns is urgency, it forgets how to feel safety. Self compassion isn't indulgence, it's chemical restoration. It resets your serotonin and oxytocin balance, the same molecules you explain to your patients. You cannot pour from an empty cup, and you cannot diagnose burnout from inside it. Sometimes you notice the shift not in your clinic but in your conversations. You stop laughing as freely. You start editing your vulnerability, not just with patients but with friends and family. You still care, but you care quietly. And that's when you realize burnout doesn't always look like collapse. Sometimes it looks like detachment disguised as composure. Work life balance isn't a line you hold, it's a rhythm you learn. Some weeks the scales tip toward duty, others toward rest. Neuroscience calls it homeostasis, the body's instinct to return to balance. And the same applies to us. What matters isn't perfect balance, but remembering to return to yourself before you burn out of shape, to notice which parts of you still need sunlight. The truth is, the heart never stops being a doctor. It keeps diagnosing, feeling, repairing, even when it's the one that needs healing. And maybe that's what makes you who you are, someone who continues to show up for others while slowly learning to show up for yourself too. And yes, families, teachers, and caregivers of every kind do it too. But in medicine, you absorb the emotions of so many, you begin to carry their energy in your own nervous system. That word energy isn't spiritual here, it's real. Empathy has a biology. It asks your body to hold what others release. Healing doesn't always mean a sabbatical or a therapy retreat, though both can help. Sometimes it starts smaller, letting silence stay in the room after a hard conversation, asking for help before it becomes crisis, treating yourself with the same kindness you'd offer a patient. It's also remembering that medicine is not martyrdom. Caring doesn't mean self erasure. Healing for doctors often begins by unlearning the script that says, I'm fine. You can be skilled and still be sad. You can be grateful and still be grieving. You can help others while learning how to help yourself. Because every act of gentleness, every pause, every breath tells your nervous system it's safe to rest again. If serotonin steadies the rhythm within us and oxytocin restores the rhythm between us, then compassion is the rhythm that we keep quietly, consistently, even when the music falters. You show up in moments when the world looks away. You carry stories that never make it to charts or notes. You walk the fine line between science and sorrow, and still you choose care. I hope something in this episode made you feel seen, valued, or at least a little less alone in the work you do. So, if you're listening to this with a tired heart, know this: fatigue isn't failure, it's empathy doing its job. And maybe the bravest thing you can do for your patients is to remember that your heart also needs care, your chemistry also needs kindness, and your healing also deserves time and space. So, tonight, if all you manage is a deep breath or a few seconds of silence before another call, let that be enough. That small pause is medicine too. And if you're walking into another shift, or maybe just trying to make it through the week, remember this: the world may not always see the quiet things you do, but they matter. Every note, every chart, every word, every act of care is a thread holding humanity together, and you're part of that weave. And even if you're not a doctor, if burnout, exhaustion, or anything said here resonates with you, please don't dismiss it. Recognize it, address it. You deserve care too. Everyone deserves care. Thank you for listening. I'm Dr. Mohi. Until next time, stay motivated. May your empathy find balance, your care find reciprocity, and may your heart, wherever it rests tonight, find its quiet home again.